They'll be going to a room here behind the stage to review the pitches and select the winner. We will welcome them back shortly for the award ceremony, but right now we move on to the next session. We are delighted to host a fireside chat focused on patient experience, a conversation about how meaningful innovation begins when patients and families are truly placed at the center. The session is titled Innovating with Purpose, Putting Patient Experience at the Center. Please join me in welcoming our speakers. You can have a seat and I will present you. Dr. Joan Vinyets, Head of Patient Experience, San Juan de Déu, Barcelona Children's Hospital. Joan holds a PhD in social communication and has academic training in anthropology and design. His career has been dedicated to people-centered innovation across design, consulting, research, and education. He has collaborated on user and patient experience projects with organizations such as Intel, HP, Vodafone, Novartis, Sanofi, Merck, Unilever, Oxfam, the Gates Foundation, and the Clinton Health Initiative. He previously served as director of the Elisava School of Design and Engineering and as director of innovation and design at Scope Impact in Finland. In his current role at San Juan de Déu, Dr. Vinyets leads initiatives to improve the patient journey, develop new care models, and integrate technology and communication tools grounded in empathy and co-creation. A warm welcome for Dr. Joan Vinyets.
Thank you.
A very long presentation.
Yeah.
And now Isabelle Bellas, Director, Clínica López, Ibor. Isabella is passionate about turning care into genuine human connection. Her career has taken her from serving as General Director of Pediatric Dental Clinics in Chicago to leading patient experience at Spain's largest private hospital group, Quirón Salud, and now directing operations at Clínica López Ibor, a mental health hospital in Madrid. Her work combines data-driven insight and empathy-based leadership, always aiming to deliver better experiences for both patients and teams through compassion, data, and innovation. Thank you very much for joining us. A warm welcome also to Isabelle Bellas. And now the floor is yours.
Okay, well, first of all, thank you so much. Congratulations for this event. It's really amazing and it's fantastic, the atmosphere that it's here. And thank you so much for the invitation. I think I can speak as both Isabelle and myself. Now we have 25 minutes, more or less, if I'm not wrong. I know you are very strict, so please go ahead. Yeah, perfect. Thank you. And so we've been asked to discuss about patient experience and innovation. And I have to say that, I'm very happy to share this time with such professional like Isabelle, because especially because both of us are very passionate about patient experience. And also because I discovered that both of us had been working in Chicago. And I think it's interesting because I have some notes, because otherwise, I'm a chaos. So I'm mentioning Chicago because I think it's very important for today's session. Because Chicago, I don't know if you know, probably you know that, but had been considered a pioneer on the human-centered design and human-centered innovation. And it's interesting because if you look back a little bit about innovation and human-centered design, in the early 20th century, Chicago started a movement that it was called the City Beautiful movement. Then also there was an architect that in the early 90s, he developed the plan of Chicago. And it's really interesting because yesterday night when I was reading a bit about that, to impress a little bit you, of course, he was saying, and this plan was focused on improving the lives of residents. And I think it resonates a lot about what we are doing today, because also we want to improve the life of the residents of our hospitals, clinics, healthcare centers. So, and this is the last about Chicago. It's interesting because in Chicago, it was started by a very important artist, Laszlo Moholy-Nagy, in the 1937, if I'm not wrong, the Institute of Design. And the Institute of Design had been the design center leading all this idea about innovation, human-centered innovation, and putting the users at the center of the innovation. And on that, I think there is a link with patient experience, because at the end, patient experience, it's this kind of instrumental facilitator to develop innovation that is real, that makes sense in terms of patients and users. So let's start the discussion. Of course, I'm not always talking myself. The idea about patient experience and maybe the first topic, the idea about patient experience and human-centered innovation. We know that healthcare is about people, it's about patients, it's about families. It's an industry that is very focused on internal processes. A lot of times we can see that it's very focused on jobs to be done. And sometimes we forget about, the real needs of people, the real needs of patients. And for example, we've been seeing here a lot of roadmaps, and very few, they've been talking about patient experience. It was about roadmap, product, etc. No? I think that patients are not only patients, but first and foremost, they are human beings. And so you need to consider healthcare from the patient's point of view. So the first question, and let's discuss a little bit, do you think that patient experience is helping to make patients truly feel seen, heard, and valued? What's your opinion about that?
Yeah. First of all, well, thank you so much for having me here, and thank you for the pitches, the 7 wonderful projects that we hear about improving also lives. But we are talking about the human connection and how we improve also from our perspective, and also something about Chicago. It was snowing a week ago, so also it's a wonderful city, but it's a bit cold city. Anyway, about patient experience and what is our role because it's bringing the human aspects to this whole process, to all these devices, to all this technology. So innovation and patient experience needs to bring, we always need to remember this human connection, because all this improving lives and better care also is about emotionally, how we impact emotionally to the people. And for that, as patient experience professionals and also patient experience promoters to the rest of the teams, we need to bring back this human connection, this human aspect.
So then, based on what you are saying, you will agree about the idea that at the end, patient experience is about putting empathy and co-creation at the heart of innovation?
Totally. It's about fresh ideas, but it's about creating value, but it's coming from human. It's coming from the need of a person, if the fear of a parent, of the pain of someone, a baby, of the timing. Is about all these feelings and all of the things coming from the human, all the human, because I think it was very interesting when they were presenting one of the projects. For example, it was coming from the Paul, no? I think it was a six-month baby, and it's always about that, about the person who is behind all these millions of people that we are going to help, but it's Maria, Paul, Joan. It's always about remember that it's there at the center.
So then, I think completely agree, that about this idea that at the end, patient experience, it becomes a kind of a very important tool, because it helps us to design sustainable healthcare solutions. And also, I think it's interesting when you think a little bit about the role it's playing patient experience, in our centers, but also thinking about other healthcare facilities. I think it's helping a lot about avoiding imposing solutions from top down, and it's more about kind of enabling to co-create solutions with the people who will be the most affected by them.
Definitely, and we sometimes forget about them because we think we have a great idea, we have a great process, and we don't ask, or we ask, but we ask, you think they will be helpful for you? And I think we need deep of that. We need to ask curiosity questions. We need to kind of ask different listening, because unfortunately, we listen a lot of patients and parents and families and clinicians, but maybe we also need to rethink about what questions we ask to these people, because it's important that when we have for this parent or this kid or this clinician also, because it's also impacting their job, is about what you were thinking in this moment, what you were feeling at that moment, in what you were deciding to do. And it helps to the parents and to the families and to the patients to understand what the process are living and thinking, experiencing. And then we can innovate about that.
Okay. So, for example, also another important point, and let's discuss about that, it's that probably if you compare the healthcare settings compared to others, I think it's been driven a lot about the scientific knowledge, and then probably what patient experience is bringing to the table is more this idea that, of course, you can have an idea and could be based on on your scientific or technical knowledge, but at the end, it's helping a lot institutions like our hospital, your clinic. It's about to foster. It's helping to kind of to foster this culture of empathy across the healthcare organization. No, this idea of you need to put yourself on the shoes of the patient. You need to put yourself on the shoes of the family, of the caregivers, and then probably if you feel what they are feeling, if you see the pain that they are having, probably your solution will be suit better in terms of their needs.
Definitely. You cannot, I think that's very important. And we have a lot of bias, of course, and sometimes it's not easy. But the best knowledge is it comes from that, from putting in the other shoes, in thinking differently, in not having this bias, or trying to moderate this bias, to understand what they are feeling, what they're thinking, and how we can do it together. And also something that I really like also is bringing to the caregivers and the professional, the clinician, what they do. Why they do what they do, because it's also sometimes we forget about our purpose, and it's also our table. No, it's innovating with purpose. What we do, what we care about the patient, what we innovate about the patient, what we bring to the table about the purpose.
So in terms of this, this area about the purpose, I think also that's another important point, because normally when you think about about innovating to create a solution, normally you are very focused on a specific aspect, on the job to be done, but then probably you are missing some kind of all the different context, and probably. I think this is a kind of I think that it's very important thinking about the innovators here, that so many times you are very focused on your solution, on the futures of the solution, but probably you are missing the whole context. And the whole context is it's not only the end user, but also it's all the different stakeholders around this solution. So understanding the barriers, understanding the different needs related to this potential solution, probably this is something that when you have an approach like patient experience, it could help you to create to create products that are more patient-centered.
Definitely. I think, some of the questions that you may ask when you are innovating is, what will be something that can change the direction of my project because of a feedback of someone that I was not expecting. I think you need to put in the process of asking that and putting in uncomfortable solutions, because uncomfortable position, because you already know your idea. You think you're gonna do that. You're gonna improve that, and then it's gonna be more efficient. But let's say put it in the other way. How what will be the question or the testimony of someone that is that you don't expect that can change my project? And I think this can help more center and more focus to the benefit of that we want.
Okay, so then we agree about the role that can play patient experience in a healthcare facility center. So what are the kind of barriers that have you been fighting with?
I think, something that is easy, is that when you see all these projects and you think, oh, innovation is about technology, or innovation is about devices, innovation is about, even if it's a small change, something that can do better, that can be done in a different way, that has more value. And sometimes it's not about money, it's about listening, about connecting, about, relationships. And I think this is something that we miss because we start our project and we miss maybe the patient, or we miss the clinician, or we miss, the whole context. And if you are aware of what is going on, if you talk to people, if you think small details that can change and have a big impact. We also saw one of the speakers talking about the big and the bang and the mind. But yeah, small things can improve, and we don't need to do a big project. Of course, if we have the money, if we have the resources, if we want to change something bigger, of course. But let's start with something small. Let's only ask people what they will do in a different way, how we can do differently. Let's start by this. Let's start by this conversation.
I think this is a really important point to ask, the potential users. But for example, before, I think, if I'm not wrong, it was in the last presentation, about the Portacat, that also one of the questions from the jury was, and have you think how it will help the kid if they want to do sport, if they want to. So I think also on that, it's really, it's really interesting, the patient experience, because it's about that. It's about understanding the patient, not as a patient, but as a human being, as a person that have, things to do, worries, needs, desires. So understanding this context, it's vital. It's something really, really, really important, because it can provide you a lot of information. Because so many times you could think that, the thing that is more important for them is safety. But maybe under this idea of safety, there is something behind that it's more kind of emotional. So on that, probably what you are saying, and what we are kind of trying to share with you, it's this, that at the end, patient experience, it could help you to provide this bigger picture, this context, that also it's very important, because at the end, the product, the solution that you are thinking, it's not only about the job to be done. It's about the job to be done, plus all the different needs that sometimes are not only operational or very functional, sometimes are a lot about emotional.
And also ask, it's not the same for every patient. So you think, maybe, you're going to ask something that, for example, let's say, what will you do if you don't have this Portacat? What will you do? Because maybe it's not going to be swimming. It's not going to be something they don't like. It's also about thinking that each patient is a human being, a different human being. And even if you think that for you will be, swimming or tennis or whatever, maybe it's not the same. So let's integrate this part of the human aspect in all these contexts to make sure that we are going to addressing their needs, their feelings, and their life better, a better care.
So probably, we could say, that at the end, it's kind of, helping to provide long-term viability solutions, solutions that at the end are more sustainable, because probably you had to spend some time understanding better, more in depth, and then this is something that it will help you to avoid certain.
For sure. How many innovations failed because we didn't include, the users and not in the user in this whole environment, not only the thing, no? They were asking also the jury, no?
Yeah.
Did you test? Did you really?
Exactly,
Did you test? And maybe they say, I will buy. But how you can do the decision if you are not, if, for example, your kid doesn't have pain, abdominal pain, it's something like, it's different. What will be, if your kid is sick, what will be the entertainment that he will like? So I think it's, so many important things that we don't take care or we don't include at the beginning or even during the process. But the patient and the user must be at the start, during the development,
exactly.
and at the exit.
Exactly, completely. And I think, excuse me, I think also this is very important because today, and we've seen here today, a lot of innovation, when we think about innovation, and especially when you think about innovation, it's all about technology driven. Yeah. It's all about technology. And I think, today here we have a lot of innovators, entrepreneurs, and often when they are starting, the starting point for a solution is an idea, a new feature, a new app, something, a new technology. And I think maybe I'm completely wrong, but I feel sometimes that frequently the innovators jumps in a kind of a very mechanical way to the final solution. And let me put an example. No, so for example, nowadays we have a lot of hospitals that are becoming highly technical environments. There are a lot of devices. There are a lot of machines equipped with multiple alarms. So what happened at the end is that now we have a problem. That it's the alarm fatigue. Yeah. So, at the end, what patients want, it's, they need a silent and quiet and peaceful place to be because they are in a very vulnerable situation. Mm-hmm. So, and I think at the end, it's about that. You need the context. If you don't have the context, probably at the end, you could be kind of, delivering a solution that maybe it's feasible, it's technologically very factible, but at the end, it makes sense. It's providing value. It's something that users at the end will adopt, or they will reject because it doesn't make sense. No, so I feel like patient experience, it can help a lot about this area of human-centered innovation, and not innovation that it's centered on you. It's not about you. It's about the real users. So
I think that's our main role, is bringing back this human connection and this human aspect, this human insight, every single moment. I know that sometimes they include, the patient and or the families in the process of innovation. But let's imagine, a world that in each meeting that they have in the whole process of the innovation process, they have a patient, a family.
Yeah. So I don't know how I lost our how many minutes we have? Yeah, this is what I was thinking. Maybe it's time to open for questions, no? Because otherwise it's kind of a little bit boring, no? So, yeah. Well, I know that this will be a really difficult question.
Wow.
I think that the jury to the microphone. Yeah, so thank you so much. I couldn't agree more with what you've been talking about and taking account experience of, in this case, a patient. I've got a very kind of scientific-oriented mind, and I like to measure things. And in order to be able to assess whether this works or not, what improvements brings to the process. I would like to have some sort of measurements. And I just wanted to ask you, because what I hear all around is this is difficult. And we are talking about qualitative measurements, and we're going into an area that maybe scientists are not that used to, and it takes a cultural change to actually think how this actually can impact and how to convince people to do it. So I just would like to listen to you, what your view on this is and how you would approach it. That's it.
Okay, yeah. Well, first of all, one thing that is very important. Innovation is about risk. Without risk, there is no innovation. It's something else. So then the approach of patient experience, the approach of user research, however the tag that you use, at the end, it's helping you to minimize the risk. But the risk is always there. So then the other thing is you have several approaches. And normally what works better always, it's mixing methods, qualitative and quantitative. So probably at the beginning, when you are exploring a concept, an idea, you will need a very qualitative. So then in-depth interviews, case user scenarios, validating with potential users, targeting very well the users, having conversations, having focus group. This will provide you, very good insights. And then based on these insights, then you need the quantitative part. Then, okay, let's validate that, and you can validate the price, how much they will pay for that. You can validate features with other features that they are willing, they are enjoying, they are willing more to use. So you can start to validate certain items. And then I think what's very important is that, during all the process, from the earliest stage, from the fuzzy front end to the final development, you need to do a lot of iterations with the potential users. So I think that will be the best way. And finally, of course, we always try to make quantitative the qualitative. And that's really difficult because qualitative have value in itself. But of course, triangulation and this complementarity of methods, it's what could be the best.
Yeah, I totally agree. And having also the team, a different team that has also these skills and combined, because especially empathic people, and it's not only the empathy is not going to go through neither. So it's about combining this and asking the other, listening the scientific part that is saying, okay, the data is okay, it show us this, but it's the combination. I think it's totally you cannot do without the other. Thank you. No? We have the winner? Oh!
Finished? Yeah. Round of applause, everybody.
Thank you.
Thank you very much, Isabelle and Joan.